Hi, it's Nancy from Exit Realty Midwest, and I am here today at Lakes Regional Healthcare, and we are talking all things Planet Heart. February is Heart Month, and I wanted to take the chance to talk to Nicole Engvall so she can enlighten us all about the great things that we have right here in our community so you guys can take advantage of keeping your heart healthy. So thank you so much for meeting with me. I'm excited to learn about Planet Heart. As I kind of mentioned, my husband and I have both done it here. So it's a great service that you guys offer. But tell everyone, what's Planet Heart?
Sure. So it's, like you said, a wonderful service that we provide at Lakes Regional Healthcare for our patients. So as for who can have it done, men age 40 to 75, women age 45 to 75, and it consists of a few different tests. Our Planet Heart nurse will follow that patient along through the process. They will go to different scan areas in radiology, one being a CT scanner to check for the calcium score of the heart. So what that is just seeing, has there been any buildup of plaque within your heart? And these are things that you wouldn't know, you can't detect, because it's just a silent thing that happens to us as we get older.
So that could be like an indicator though, or a number that could be monitored to tell you, is there anything current that maybe needs to be addressed?
Right.
Or, if you do, to be able to say, okay, maybe we need to make some changes lifestyle wise, right? So that it doesn't keep getting to a bigger number.
Yes. What we want to prevent is for you to not go to the heart hospital on a cart. We want you to come to us walking in the door.
Yes.
So this is a great way for you to be proactive, like you mentioned. We have a set of guidelines for, depending on what your score is, how often for you to come back and have another one. If it is within a mild, moderate, or a higher range. And those are things that will scan into your medical record. You can talk with your provider about if they want to refer you to a cardiologist. If there are some things that are a little bit more concerning, you can do that then, and then you can get the workup that you need to. But yeah, that's one of the things that we do in CT. That calcium score is a very good thing. In addition to the calcium score being done, you'll have those results right away, talking with the nurse that day. The radiologist will also read your scan. What's great about that is if you have any incidental findings, say you have a lung nodule or something like else hanging out there, they'll read that and that'll go to your doctor and they can follow up with you if there's any other concerns. The vascular check with ultrasound, they take pressures of your arms and your legs. If you remember that you lay down, they use the gel and they look at to make sure you don't have a aneurysm of your abdomen, aorta, and then looking at also your carotids for any plaque buildup, and just vascular in general on those main areas that they're doing what they should be doing, and there's nothing that looks questionable that
was one of them that I thought was really interesting when I had it done was, they put the cuffs on your ankles, right?
Yes.
And so they're checking, and I was like, okay, what are you doing? And they were like, we're checking the blood flow through your arteries of your legs. And I was like, wow, from somebody who didn't really didn't know what they were all going to check, that was pretty cool for them to be able to realize, like, okay, I'm getting everything checked. I mean, from head to toe, like they're going through and doing a good check on that.
Yeah, it's a very comprehensive study. Just remember, it is a screening tool, not a diagnostic tool. This is something that we really just ultimately offer up to the community as a really nice tool for screening. So
well, it's a perfect time now because February is Heart Month, and so that's why we wanted to really take the time and learn about Planet Heart now, because we think that it is a great resource in our community. We've got a spectacular hospital with great services, but this is something that maybe you could do on on a basis where you could get a baseline and kind of just check it out. And if there is something, you might, learn some things about yourself or some things that you need to change. Or you might find out that, I had a calcium score of 0 and I was like, yes! So you might get that information too. And then you realize you don't have to come back quite as frequently and you're doing good things.
Doing a good job, yeah.
Well, thank you so much. We do appreciate it. How can they make an appointment if that is something that they would like to do?
You bet. So they can call our scheduling number, and that's 712-336-8658. but it does not require a doctor's order as long as you meet all of your guidelines. And if you don't meet the guidelines, that just might mean that your risk is too low, and that's not a bad thing either, and it's just not time yet. But
perfect. Well, there you go. February is Heart Month. If this is something that you think would be very beneficial, or the information would be great and you qualify, I highly recommend doing it. As somebody who's done it myself, it is very non-invasive, it is not scary, and it doesn't take very much of your time. And we're very fortunate to have a program like this right in our backyards at Lakes Regional Healthcare. So thank you so much. Thank you for chatting with us and enlightening us on what Planet Heart is all about. Nancy Vierkant with Exit Realty Midwest, talking with Nicole Engvall from Lakes Regional Healthcare and talking about Planet Heart. Have a great day.
Thanks. See ya.